So he's saying that, you know, sometimes you might get kicked out of a pediatric practice and forced into an adult practice because you are an adult, right? So the healthcare system treats you differently. Is there anything biologically different between a 17 and 11-month-old and an 18 and 0-month-old? No, right? I remember waking up when I was on my 18th birthday, and it's like, I feel exactly the same as yesterday, because you are exactly the same as yesterday, but suddenly the world doesn't think so. And that's arbitrary, right? We just decided that adults are adults at 18. There's no biological reason that adulthood shouldn't start at 19 or 17 or 18, 3 months and 17 days, right? We just picked 18 and drew a line in the sand there. So we had the same idea. The healthcare system suddenly starts treating you differently because you're an adult. So if you were to go into an emergency room, for example, depending on the emergency room, some of them have pediatric areas and suddenly some of them have adult areas, right? You might get treated a little bit differently. So we wanted to know, if you show up as a child to an emergency room as compared to an adult in an emergency room, do we treat you differently as far as whether or not we prescribe you opioid pain medications? And so what we did was we took every emergency department visit that we could find. This is a couple 100,000 emergency department visits for kids who are about 18 years old, so between 17 and 19 years old. And we just looked, what is the chances that if this kid showed up in an emergency department that they left with an opioid prescription? And this is what we found. Right? We see generally as kids get older, people are more likely to prescribe them opioids, probably because doctors think they're older, they can be safer with this medication. But suddenly, at age 18, there's an increase in that prescription rate, and that corresponds to about a 10% increase in opioid prescriptions. And what that little increase also corresponded to was a 10% increase in the chances that in the next year that teenager would have long-term opioid use disorder, or an overdose. So this was a real effect with real problems, and it exists only because it is completely this arbitrary difference between what is a child and what is an adult. So we asked ourselves, like, well, why is this happening? Well, one thing is when you go into the emergency room, you go from like the really nice one where everybody's nice and friendly, and you go to the sort of sterile, you know, less appealing one. And you also go from like a really nice looking doctor to a me looking doctor. And on the one hand, we just look different, but on the other hand, pediatricians are trained completely different than adult doctors. We have completely separate training. So my approach as an adult physician is much different than a pediatrician's. And so when that 18-year-old suddenly starts seeing adult doctors, they're getting different care. So probably the case, as we saw in that other slide, is that pediatric emergency doctors who see children are probably more conservative with their prescriptions of opioids, and that's probably helping those kids who are about 18 years old. And then when they turn 18 years old, we're giving them too much and probably hurting them. So the lesson here is that the healthcare system, whether it's the patients, whether it's the doctors, nurses, whoever, pharmacists, we get biased by medically arbitrary things like whether the law considers you an adult versus a child. This is happening all the time, right? We have biases that you know, everybody talks about all the time: gender, race, language, all of these things are constantly biasing what we do. We have to keep in mind there's other things like this random 18 is when you're an adult that leads to bias as well. But we can take advantage of that to learn about cause and effect. With this study, we could see, okay, this is actually the effect of giving these kids this extra opioid medication that they might not need, translated to a quantifiable change in the risk of having bad outcomes from opioids.